welcome to another segment of AHS Health Matters. I'm your host, Kelly Morris. We're here today in Brooks, Alberta, and I have a special guest with me, Connie Gabrielle, an exercise specialist with the Alberta Healthy Living Program. As the days get cooler and shorter, we all tend to get a little bit lazier, and Connie's here today to tell us about how we can stay more active throughout the fall. So Connie, as the weather gets colder, the days are getting shorter, it's harder to stay active. What do you recommend people do if they tend to turn into a couch potato as the weather cools off?
It's really common actually, and I think the first step is really just to plan. If we really think about the things we enjoy and the activities that will keep us motivated, just starting off with a bit of a plan, you really truly can find enjoyable, fun things to do when it gets cooler.
Well, what type of activities do you recommend taking part in once it gets cooler?
You know what, it's just keeping it simple. So all the things we do in the summer months, we can continue to do in the winter. So for example, walking, if you get some outdoor equipment like some crampons or some walking poles, you can continue to walk safely in the winter months. If you enjoy being outdoors, taking advantage of that is a great idea. So finding an outdoor rink, trying some cross-country skiing, taking your kids tobogganing, just enjoying biking over some crisp leaves or hearing the crunch of the snow under your feet as you go for a walk. Those are all great ideas to keep yourself active and still have fun. And if you're really not an outdoor person and you hate the cold, another good idea is just to take advantage of indoor facilities. So in the fall, activities really start going again. So most programs start back up in indoor facilities. Most places offer a free drop-in for your first try. So you can just go to your city's website, go to the recreation tab, and see what's available there in your community for indoor places as well.
Well, that's perfect. Lots of good ideas. Now, the challenge that I have in the winter is it gets dark and I lose my motivation. How can people stay motivated?
So I would say motivation is actually probably the number one thing people ask me for support around. And so it's first of all important to be kind to yourself, right? So a really important thing when it comes to motivation is to schedule. So if you're really struggling with making time for yourself and your kids are busy with activities, school's back started, get out your calendar, pick a time of day, pick a day of the week and schedule it in. And then it's a lot easier to make it a priority. Another thing you can do to help yourself with motivation is to remind yourself of the why. Like, why is this important to me? Is it important to me because I want to be a good role model for my kids? Is it important to me because I actually feel better when I'm active? It helps with my mental health. So those are things that are really important because if I see it's valuable to me, I'm going to be a lot more motivated to stay active. The third thing that would be really helpful to help motivate you is to just curate an experience that will make it enjoyable for yourself. So what I mean by that is if I'm an outdoor person, then I need to, and I enjoy nature, then I need to include the outdoors and nature in my activity plan. If I really find I'm isolated in the winter and I really enjoy socializing with others, then I need to be more social with my activity plan. So for example, join an activity class, like an exercise class with others. Contact a friend or a family member that you can go do something with to add that social component. Another good tip is just to add that fun factor. I think sometimes we underestimate the value of fun. When we're kids, we love activity because it's fun. And as we get older, sometimes we forget about that. And we look at it as something we have to do instead of something we like to do. So think about things that are fun and enjoyable, and then you'll be a lot more motivated to want to do it when it's cold and when it's dark and when you're just not feeling into it.
Those are some really great tips. I know for myself, especially in September, it's gotten a lot busier with the kids and they've got lots of activities, but I don't often think about how to keep myself moving and active as much as I think about them. So do you have any other final ideas as to how we can just keep moving this fall?
Sure. Just what you said there, when we think about our kids and not ourselves, killing two birds with one stone sometimes is something to consider. So if I'm at my kids' hockey practice or figure skating practice, is there an indoor walking track that I could be walking at while I'm at their practice? Or could I be doing kind of two things at once there? Also, again, being kind to yourself. So it's hard to make behavior change. It's a difficult thing to do. And so just allowing yourself to take that time to plan, to think about what your barriers are going to be and come up with some solutions for yourself. A lot of the things that bother us in the winter months are things like seasonal affective disorder, joint pain, decreased energy, decreased mood, and depression. And if we remind ourselves that activity actually helps with all of those things. So activity improves seasonal affective disorder. It adds lubrication to our joints, which helps with pain. It also improves our energy levels. So if we remind ourselves that a lot of those struggles we have in this season can actually be treated by keeping ourselves active, then that helps it be more doable to fit it into our lives.
Well, that's excellent. Thank you so much for all this information today. I know I've gotten a lot of great ideas of how I can keep moving this fall, especially on a beautiful day like today. Hope to get out and walk around on some of these beautiful paths. Thank you so much, Connie, for being here today. This is AHS Health Matters, and I'm Kelly Morris. Hello, I'm here today with Lisa Doyle, a health promotion facilitator with Alberta Health Services, and we're here today talking about car seat safety. Hi Lisa, how are you doing today?
I'm good, thank you.
Great. So many individuals wonder what the best car seat is. Could you share some guidance on selecting the most suitable car seat for our needs?
Absolutely. A lot of parents and caregivers ask this question. So in Canada, all car seats have to meet a certain safety standard, and all car seats will be affixed with the national safety mark. It looks like a maple leaf, and it'll be a sticker on your car seat. So the best car seat for you is going to depend on a couple different factors. So one, it needs to be able to fit your child. So it needs to be within your child's age, weight, and height limits as stated by the manufacturer. Two, it needs to be able to fit your vehicle. Not all car seats are compatible with all vehicles, so we do recommend trying before you buy if that is an option. A lot of car seat stores will allow you to take the demo seats out to your vehicle to test it out to see if it's compatible. If that's not an option, I always just recommend you check with the store to make sure you can return the seat if it doesn't fit. Three, we want to make sure it's within our budget. So whether you get a more expensive seat or a less expensive seat, again, all car seats in Canada have to meet a certain safety standard, and all car seats are going to do the job it needs to do in a crash as long as they're used and installed correctly and that crash is survivable. And four, you want to get a car seat that you can use correctly every single ride. If you get something that's maybe a little bit more complicated and you're making mistakes, that is not the best car seat for you. Get one that you can use correctly each and every ride.
Oh, excellent. Of course, there's different stages of car seats. So how do I know where to start and when to level up?
Yeah, another great question and one we get frequently asked. So I always like to remind people that the law is the minimum requirement and we are always following best practice. So just because it's legally allowed doesn't mean it's the safest option. So best practice is to keep your child in their current seat until they outgrow the max weight or height requirement. So for example, if you have a child in a larger rear-facing seat, we want to keep them there as long as possible. We know rear-facing is the safest for our children, so we want to keep them there until they outgrow that max weight or height limit as stated by the manufacturer. This may be when they're 2, 3, or even 4 years old. And I always like to share too, sometimes parents are a little bit worried for rear-facing if their child's legs are scrunched or pressed up against the back of the seat. That is totally fine, totally safe, and it is not a reason for you to move your child to a forward-facing seat. We want to wait until they max out either the weight or height limit.
Well, that's a very good point because I've definitely heard, oh, they're uncomfortable like that, so let's get them turned around. So thanks for that reminder. If you could share just one crucial piece of advice for installing a car seat, what would it be?
So there's a lot of tips I can give, but one of the most important tips I'll share, and one that's often forgotten, is to read your car seat manual. It's a very basic tip, but a lot of people forget to do it. So car seats in Canada are not design restrictive, so they can all be a little bit different. So it's really important you take the 20-30 minutes, read your manual really thoroughly, and then also take time to read your vehicle owner's manual as well. That's going to give you information as to, for example, where you can install the seat in your vehicle.
Could you demonstrate some expert advice for securing a child snugly and safely in a car seat?
Yeah, absolutely. So today we have Faye, a little helper, to show us how to demonstrate a child securely in a car seat. Faye is currently in a 5-point harness forward-facing car seat, so that's what I'm going to be demoing today. If you do have a child in a rear-facing car seat, the difference is that you're going to want the harness height at or below their shoulders. For forward-facing, you need it to be at or above, like we see on Faye currently. So to make sure your child's done up nicely and securely, first step, we're going to make sure the harness is nicely on their shoulders, which we see. Next, we're going to do up the crotch buckle, and I'll just get you to there we go. We'll get the other side. When doing up your child in your car seat too, you want to make sure they're fully against the back of the seat, so there's no gappage at the back. So now that we've got the crotch buckle done up, we're going to do up the chest clip. I like to keep it low for now, and then we're going to fix that after. So we want to make sure we get all the slack out of the legs. That's sometimes a mistake that is forgotten. So we're going to pull up, get the slack out of the legs, pull up until we get all that slack out. And next, we're going to move the chest clip to armpit level. And lastly, we're going to make sure that this is nice and snug. So we're going to do the pinch test. So we're going to pinch the fabric at the collarbone. So we can actually tighten it a little bit more. So now I can't pinch anything, so I would know that that's a nice and secure fit.
What about in the winter? What are the do's and don'ts regarding winter gear? How do we keep kids safe and warm?
Absolutely. So it is really important that we don't wear any puffy winter coats, any gear like snow pants, because in a crash, these pieces can compress and it can leave space between your child and the harness for them to slip out. So it's really important that we dress them in basic thin layers, and then we can put their coats on when we arrive at our destination. While they're in the car seat and they're secure, you can also put a blanket on them to keep them warm. This also goes for sports equipment too. I know we're heading into hockey season, so make sure you dress them in their base layers and then put their equipment on once you arrive to the arena or your destination. If you're not sure if a coat is safe or not, maybe you have a thinner coat, there is actually a test you can do, and I'll show you here today with Faye. So what we're gonna do is we're gonna undo her snug harness, and we're gonna get her to throw on her coat. So I'll get you to put on your coat, Faye. So get your child in the coat you wanna test. And then do it up as you normally would. There we go. And then I'll get you to sit back, Faye, in your car seat. Perfect, make sure you're fully back. And then we're gonna do up the harness as we normally would. So making sure the harness is nicely sitting on the shoulders. We're gonna do up the crotch buckle. There we go. Oh, sorry, Faye. And then, again, we'll do up the chest clip. We'll get that slack out of the leg area. Make sure there's no twists in your harness as well when you're doing up your child. And then we're gonna move our chest clip to armpit level. And then we're gonna do the pinch test, so checking for tightness. And then you're gonna use a piece of chalk, and on the harness adjuster strap, you're gonna draw where you tightened this to. So we can see where we drew the line right there. Next, we're gonna loosen the harness. We're gonna get Faye to take off the coat. And then we're gonna get her to get back in the harness, and we're gonna do it up again as we normally would without the coat. Perfect. So we'll get your harness straps on your shoulders. And then just make sure we're up against the car seat. There's no space at the back. And then we'll do up our chest clip. We'll keep it low for now, and then get the slack out of the legs. And then we'll do that at our armpit level. And then we're gonna test for tightness. So I'm gonna draw another line with chalk. So as we can see, there's a lot of space there, and I actually have a tape measure. So that's an additional 3.5 inches of space. So we'd know that this coat is not safe to use with the car seat. So that's a test you can do to see if your jacket might be safe if you have a thinner one you're not sure of.
So I know that car seats have expiration dates. So what steps should be taken when our trusted car seat reaches its expiration date or faces an unfortunate crash?
Absolutely. So all car seats will expire, and if your car seat has been in a crash, in Canada you do have to replace it and dispose of that correctly. So once it has been in a crash or it has expired, basically we want to make sure if someone was to find this car seat at the garbage dump that it would be unusable and that they wouldn't use it. So we want to take off any padding on the shell of our car seat. We want to remove the harness system. We want to cut it up. You can even write expired or crashed on the shell of your car seat as well. A lot of people ask, can I recycle my car seat? So many car seats have metal integrated in the frame, so you can't usually recycle the entire seat, but you can try to recycle certain pieces if you would like.
Great. Thank you so much, Lisa, for all this information, as well as thank you to Faye for showing us all of the demonstrations of how to safely use our car seat. Hello and welcome back to AHS Health Matters. I'm now joined virtually by Amy Dockery, a dietitian with nutrition services. And today we're going to talk about fermented foods. Thanks for joining us, Amy.
Thank you for having me.
So what can you tell us about fermented foods?
Fermentation uses bacteria, fungi, and yeast to transform the flavor and texture of many foods. Humans have been using fermentation for thousands of years, and fermented foods are common in many cultures. For example, cheese, kefir, kimchi, and sauerkraut are all different kinds of fermented foods. The flavor that comes from fermentation depends on the microbe or the yeast that is used. In a strong cheese or a tangy kimchi, it's the different microbes that are creating these deep flavors.
That's really interesting. I honestly didn't know that cheese was considered a fermented food. But one question that I have now is, what is the difference between pickling and fermentation?
Yeah, pickling and fermenting are often confused to be the same process, but they are quite different. Pickled foods get their sour flavor from an acidic brine that's added to the food. In fermentation, it's the bacteria that create the sour flavor without any added acid. For example, store-bought pickles are made with a vinegar brine and are pasteurized, which actually removes all the bacteria and makes fermentation impossible.
Oh, that's interesting. What are some of the health benefits of eating fermented foods?
Fermentation breaks down the food, which can allow the nutrients to be absorbed more easily by the body, and it can improve the digestion of the food as well. Some fermented foods also contain probiotics, which are live bacteria that are proven to have a health benefit. You can find probiotic yogurt or kefir at the grocery store, and they'll be labeled as probiotics, so they're really easy to find. Things like kimchi and yogurt have these microbes, but just in smaller amounts. Some store-bought fermented foods might not have any live microbes in them at all, which is why it's important to look for the label. Although we know about some of the nutrients and probiotics in fermented foods, research in this area is still new. There's lots for us to learn about how fermented foods affect our health, and consuming a variety of foods is our best bet to ensure we're getting all the nutrients we need.
And what are some different ways to enjoy the fermented foods that you've mentioned today?
There's so many ways to enjoy fermented foods. You can add sauerkraut to a sandwich, you can enjoy it with pierogies, or you can use the juice in a pasta sauce to add an extra depth of flavor. You can also enjoy a probiotic yogurt in the morning with some granola and berries, or you can make a kimchi fried rice for lunch. And don't be afraid to get creative with your recipes. My personal favorite is a kimchi Alfredo pasta.
That's an idea I wouldn't have thought of. What about fermenting foods at home? Is that something that you can do, or is it only something you buy?
You can definitely ferment your own foods at home. The microbes needed for the fermentation exist naturally on some foods, but for other recipes like a kombucha or a yogurt, you will need to have a starter culture to get the fermentation going. For something like a kimchi or a sauerkraut, all you need is your vegetable of choice, some salt, some additional seasoning for flavor, and an airtight jar. Of course, if you're fermenting your own foods at home, food safety is really important. So it's important to clean and sanitize your equipment, use enough salt to preserve the foods, keep the air out of your jars to avoid spoilage, and of course, refrigerate after opening.
Oh, that was some excellent information today, Amy. I'm definitely inspired to try out some more fermented foods. Lots of good ideas of how to enjoy them at home. Thank you so much for joining us today and sharing all this information.
You're welcome. Thank you for having me.
Hello, I'm now joined by Pat MacIntosh, a public health dietitian with Alberta Health Services. And today we're talking about vitamin D. Pat, what can you tell me about this vitamin?
Vitamin D's main purpose really is to help our bodies absorb some calcium so that we can build and maintain strong bones and teeth. It does have other important functions though, like supporting our immune system and with muscle function. It is sometimes called the sunshine vitamin though, not like today where there's no sunshine, but in the summer months, April through September, when our skin is exposed to the sun for maybe 10 or 15 minutes, our body can make some vitamin D. Of course, there are factors like if you're outside in the winter, if there's cloud cover like today, if you're wearing, clothing like a long sleeve and cap to cover your skin or sunscreen, time of day, even age, all affects how much vitamin D we can produce. And so we really need to be aware that we have these needs, and I guess people my age up to age 70 need about 600 international units a day. 70 and older need 800 international units a day.
Okay, so besides the sun, where can we get vitamin D?
Well, we do get that little bit of unreliable sun exposure, right, in the summer months, but we do have a few foods that provide vitamin D as well. Good sources would be eggs and fatty fish like salmon, sardines, mackerel, trout. About a few ounces of those fatty fish would give us maybe 100 to 200 international units of vitamin D. Some foods do have vitamin D added, like margarine, cow's milk, even plant-based beverages that are fortified. So 1 cup or about 250 mils of milk or fortified beverage would give us 100 international units as well. That will be doubling though, because Health Canada has doubled that fortification level, so it'll be going to 200 international units.
Oh, that's great.
But of course, now that we've mentioned that the sun's unreliable and there's so few foods, for that reason, Alberta Health Services has recommended that to meet our vitamin D needs, we also take a daily vitamin D supplement.
And what do we look for in a vitamin D supplement?
So there's a lot of products, of course, on the shelf. When you're looking for a vitamin D supplement, we recommend that from birth, newborns to age 50, we take 400 international units of vitamin D a day. For infants, we're looking for a liquid form, either single drops or the dropper full in just a single vitamin D format. We don't want any other vitamins or minerals added. For older children and adults, there are other forms as well, like gummies and chewables and tablets and soft gels. And those can be as multivites if we choose, so either individual or multivites. For older adults, we want 800 to 1,000 international units. And the doctor may prescribe more for those individuals, but that's sort of our public health recommendation for supplements.
What about taking too much vitamin D? Is that a thing?
It is a thing because vitamin D is a fat-soluble vitamin, so it dissolves and is absorbed and stored in our body fat. It doesn't get flushed out in our urine like water-soluble vitamins do, so for sure we can get too much. When we're looking at what we call the upper limit, for children 1 to 3 years of age, it's 1,500 international units a day. For 4 to 8 years, it's 3,000, and for 9 years and older, for adults, it's 4,000 international units a day. It's not likely, though, that we'll get that upper limit just from food sources or from the daily supplement. Certainly your doctor may prescribe higher doses, but that's part of their care plan and part of ongoing monitoring. We don't recommend that anybody self-prescribe higher levels for themselves.
Very good point. Is there anywhere that people can go to find out more information about vitamin D?
Oh, definitely. So My Health Alberta, and we've got a nutrition page, which is Healthy Eating Starts Here, has some very good resources and handouts and information on vitamin D for families.
Great. Thanks so much for being here and sharing this information today,
Oh,
Pat.
you're welcome. Thank you for having me.